Hi,
Hello.
good to see you.
Ah, nice to see you too. Good morning.
Good morning. Yeah, it's just barely getting light out here. So you have to work today, I gather.
I do, yeah. I leave here at 2 o'clock.
So thank you so much for offering to do this. I was hoping that, given what's going on and the anxiety in the world today and everything with the coronavirus, I was obviously interested in getting your perspective on what's going on from your perspective as an intensive care nurse. But I am hoping that maybe if this is not too painful and you enjoy talking to me, that maybe we could try another one later or another time to talk about the religious scene in Denmark as well. But it seems that Denmark is shutting down completely like everywhere else. Do you feel like you've got a head start at all, or you also feel like you waited too long like everyone else in terms of?
No, I think we got a head start. I think that the government was quite early on in shutting down different venues and making sure that no one sort of brought on the virus. But I think that the health system has been a little bit delayed, probably because they haven't taken seriously that the virus could come from other countries than what they first expected. So we've had a lot of tourists who's been on holiday who came home with the virus, and they knew that they were infected and tried to tell the health service that they were infected, but because they didn't have any symptoms, they weren't tested. So, but now they're not testing as much as they did before they tested everybody who had a probability of having the coronavirus. But right now they have decided that they are only testing people who have severe symptoms, and otherwise you're just told to be at home and go to bed and take care of the virus as if it was an ordinary influenza.
So is the social distancing really working there? In our class, we've been studying how, in a way, in Scandinavia, there is a sort of conformity that people sort of have a sense that we're all going to do the same thing and we adhere to similar values. Is
Yes.
it working, or is there any tension there around groups that are not doing it, or are there any tensions around non-native Danes even?
I don't think that there's a lot of non-conformity. Lots of people are following the guidelines and staying at home, but it's mostly young people who find it really hard, that they can't see each other, that they can't just join up for a quick meeting. And we have I know that there have been lots of different influencers on YouTube trying to tell them to stay at home and to stop gathering. I think that's the worst part, really.
You're obviously watching the media in the rest of the world. Do you feel like Denmark is doing things differently, and if so, why?
I think that what we have done differently than lots of other countries is that we've sort of shut down quite early on. And I hope that this will sort of flatten the curve so that we won't get as many people admitted into hospital. We've only had 6 people died here in Denmark. And I think that's because we've been out so early and shutting everything down, making sure that people didn't ride too closely on buses and trains and, using public transport. And I think it's paying off in the long run. At my hospital, it's Aarhus University Hospital. It's the second largest city in Denmark. We've only had 3 patients in ICU so far, and that's pretty good. And we are ready for. We have the capacity to take 130 on ventilators if need be.
So it doesn't sound like you're expecting to be overwhelmed and inundated in any way, that you can.
I think we are expecting to be overwhelmed. But the thing is that we have prolonged the intake of patients by doing this. So we will get some kind of a wave of patients at some point. And right now we're training early intubation. We know that early intubation is the one thing that can save lives. And I think that they weren't aware of that in Italy, so they sort of prolonged the intubation or the point of intubation as you normally do. And the thing is that has probably cost a lot of lives. But here we are intubating really early, and we are training to do it in as soon as patients come in. So we think about 45 minutes, and that's when we will have everything under control for each patient. We work in teams, and we do simulation training to make sure that we can get people on the ventilator as fast as possible.
So how about healthcare workers? Is there anxiety about it spreading among healthcare workers there? Has it happened already?
Yeah, I mean, yes, because there are a lot of questions about getting the right equipment, getting masks and getting the right masks, getting the right protective gear. And even though we have gear that we would use for Ebola patients and things like that, we have been told that the coronavirus is not as infectious as the Ebola is. So right now we are trying to limit the use of protective gear for people that don't need to wear it. But I think that we have to do our own sort of not tests, but make our own what do you call it? Sorry, like we have to make our own experiences before we can say what is working best for us.
Are you personally anxious about being at work? And
I saw some videos from the Wuhan province in China where the healthcare workers are really overwhelmed, breaking down mentally, and where they couldn't get rid of the corpses. They've had the same situation in Italy. And I must admit that one day, there was one day where I was just sitting on the couch and thinking, I won't be able to manage this. But now I'm a bit more settled, and I'm not looking forward to this because no one is. But I think we'll manage. I think we can cope.
Well, you know, everybody's pulling for everybody, but particularly people like you who are helping save everyone's lives. You know, this, I guess I want to ask you a little bit about sort of how this could play into the politics a little bit in Denmark with immigration. Obviously, for the last, even 10 years or more, there's been a lot of talk about keeping people out of Denmark, and now with the border closed, I wonder how you see this in the bigger picture.
Well, the health service have already stated that it won't reduce the coronavirus from spreading to close the borders. So that's a political decision. Right now, I think it might be a wise decision because of the coronavirus, but otherwise, I'm all for the borders being open. But that's my political point of view.
I mean, I only been following Danish People's Party a little bit from when I was living in Sweden. It seemed like during the EU election, it was kind of it was going down a bit, and that maybe the environmental movement was sort of on the rise.
Yeah.
But that's correct?
That is correct, but now one of the environmental parties here in Denmark, a political party called the Alternative, have had some issues in their top leadership. So I think that they are more or less falling apart, and the other parties in Denmark, and we've got a lot, are gaining more voters than before.
Wait,
I don't think the Danish Folks Party, as they're called, is a sort of a right-wing party, and I think that their voters are mostly elderly people, and they'll probably get the same amount of voters.
So the coronavirus situation, you don't see that as making people more afraid of foreigners and more afraid of having open borders and taking in it?
No, I think that they've had that this kind of that's been their attitude, their meaning all the while. So this won't make any difference. It'll just make them stronger in their beliefs that the borders should be closed. But I think that most of us know that that's not where the virus came from. It didn't come from foreigners. It came from tourists, from, you know, taking trips abroad, going on skiing holidays in Austria. That's where most of the coronavirus came from. Going on skiing holidays in Italy. So it's not foreigners that brought the coronavirus here. It's us when we travel.
Okay. Well, anything else you want to sort of share about what's going on generally there at the moment? What's the mood in Denmark?
I think that even though we are sort of apart, we are still holding on together. The Danish Queen means quite a lot to the Danes, and she's been out making a speech publicly on television, something that hasn't happened since World War II, that the royal Danish family has made public appearances on television, apart from the New Year's speech that she always does. But this time she was sort of making a point that we have to stand together by being apart, and that was really nice. I think lots of Danish people appreciated that. Yeah, so, and tomorrow morning I'm joining in singing from home. So we're all singing out of the windows and on the balconies, and lots of people are doing it every Friday. And tomorrow morning it'll be broadcast on television, different songs, and on radio, and I'll take part. I live in a little village, and the village has a Facebook community, so it's been on there. So I hope that all my neighbors and the villagers are going to join in, so we can hear each other in the backyards and in the gardens singing.
Is this going to happen daily, or is this just a one-time thing?
And this will probably be a weekly thing, that it'll be broadcast on television and on radio, so you can join in and you know, hear the melody as well as when you sing. But I think that in Copenhagen, I know that impromptu things like this has taken part, and especially every Friday evening they do this.
That sounds great.
Yeah.
Okay, I want to keep these relatively short, so why don't we stop here, but stay in the room and we can talk for a minute off. I'll turn off the recording. But thank you for talking to the class about the situation. I know it's going to be evolving week by week, and you're in our thoughts as things move forward. Thank you so much.
Thank you, Matthew. Bye.
All right.